periods of time. And the stress hormones we're going to talk about are DHEA and cortisol. These hormones are made by your adrenal glands. They are absolutely necessary for survival. If you do not make cortisol, you die. And they prolong the effect of the fight or flight response and help you with the recovery from stress. So they're not bad hormones. They're very important hormones in the right amount. DHEA, or DHEA sulfate, which is the storage form. DHEA is the most abundant steroid hormone in circulation. You have more DHEA than any other hormone. We think it serves as a hormone buffer. In other words, there are no known direct activities for DHEA, no DHEA receptors that have been found in the human body. But it is the precursor for your ability to make estrogen and testosterone. The levels fall dramatically with age. This is known as adrenopause. So you make about 30 milligrams at age 20 and less than 6 milligrams at age 80. Some rat and very preliminary human research shows that DHEA may extend lifespan and youthfulness. It may also lower blood sugar, especially if your blood sugar is high, very important for restoring insulin resistance. Improves the immune system and keeps it healthy, and is necessary for optimal brain function. And enhances quality of life. So this area here is the hippocampus that's being lit up. Hippocampus, extremely important part of the brain, responsible for your ability to make memories, especially new memories. So DHEA has been shown to act as an antidepressant in the brain. As I said, it improves insulin sensitivity. It promotes the synthesis or the formation of new neurons, so new nerve cells in the hippocampus, the area of the brain that's responsible for memory. This is the first area that gets damaged in Alzheimer's disease. And it enhances glial cell activity. Glial cells are the supporting cells for the brain, not the neurons, but the supporting cells, and enhances learning and memory. So you've learned how important estrogen is, progesterone, testosterone, and now you know that DHEA is also an important brain memory, or brain hormone. DHEA plays a role in a healthy immune system, so it increases something called natural killer cells and decreases interleukin-6, which is an inflammatory cytokine. And natural killer cells go around, and they're your surveillance system to kill viral infected cells and cancer cells. Low DHEA has been found in lupus, dementia, breast cancer, and rheumatoid arthritis patients. The lower the DHEA, the worse the symptoms in the disease. Chronic disease causes your adrenal glands to shift production from DHEA to cortisol. And low DHEA may indicate some evolving health problem. So DHEA is available over the counter. I would caution you to be careful if you do take it. Again, remember that hormones are meant to be in balance. It converts more into estrogens in men. So I've seen men coming in with on 100, 200 milligrams of DHEA. Remember, a 20-year-old only makes 30. And they'll end up with breast development. It converts more to testosterone in women. In fact, DHEA commonly can cause acne. I see acne more with DHEA than I do with testosterone in women. You need to monitor it if you're going to be taking it. And please don't use it over the counter if you have breast, uterine, or existing prostate cancer. So let's talk about cortisol. You've probably heard the term cortisol. You've heard about the hormone cortisol because there's so much information out there about how bad cortisol is. Again, if you didn't have cortisol, you would be dead. So cortisol is both a good and bad hormone depending on the amount being made and why. So I liken it to the wind, which can be used to harness energy or produce energy or make a tornado. Here's the good aspects of cortisol. It's required for blood sugar regulation. You need it to increase your blood pressure when you're exercising, when you're stressed. You need it for a healthy immune function. You need it to control inflammation. In fact, some of the most powerful medications we have to control inflammation are called corticosteroids. They're synthetic analogs of cortisol because they are so potent at lowering inflammation. You need it for energy and endurance. In fact, sometimes if my cortisol level's been low because I've been under some significant stress, I will take some cortisol before a running event or an athletic event because I know I need it for my energy and endurance, and it helps me. And you need it for your mental ability and your ability to focus. But unfortunately, chronic stress can cause terrible symptoms like inflammation. It can also decrease growth hormone, and growth hormone is the anti-aging hormone you need to repair your tissues. Too much cortisol also decreases testosterone. It inactivates thyroid hormone, and it lowers serotonin in the brain, which is how you can end up with depression after years of chronic stress. Also sugar cravings, carbohydrate cravings. High levels of cortisol over time can contribute to bone loss. In fact, osteoporosis, common consequence of prednisone use. It can cause high blood pressure, and it can cause immune dysfunction, so frequent infections or allergies, autoimmune diseases or cancers. And this is a meta-analysis of 300 studies. So whenever you see the term meta-analysis, what that means is that some researchers have looked at the pool of data on a subject, and they have inclusion criteria, so they pick studies that seem to be good studies, and then they come up with a synthesis of all the studies to give you information. That's what a meta-analysis is. So this was a meta-analysis that was done in 2004 of 300 studies looking at what is the role with stress in the immune system, especially chronic stress. And what the researchers found was that chronic stress, so long-term stress, was associated with suppression of all aspects of immune function. Chronic stress can also cause memory problems. So cortisol, for those of you who are geeky, increases glutamate and blocks its reuptake. And glutamate, a small amount necessary for learning. But there's a high concentration of glutamate receptors in the hippocampus. Remember, that's the area of the brain responsible for new memory formation. Chronically high glutamate, so lots of glutamate over time, actually causes something called excitotoxicity, which means the cells can actually die or atrophy. Some of this is reversible if it's short term. Some of it might not be. Other bad aspects of cortisol. It can cause fatigue. It can cause other hormone problems if you've been making lots long term. Infertility, because if you're running away from the tiger, making a lot of stress hormone, who needs to reproduce? And it can cause weight gain. And I think this concept of how stress causes weight gain is important. So I've put together some slides to explain to you, well, exactly how does stress cause weight gain? Because you've heard this, right? This is a card my mother sent me years ago. I've been a lot more relaxed since I discovered that stressed is just dessert spelled backwards. Probably because my mother is the type of person who would eat dessert to manage her stress. So this is number 6 if you're following along, or if you're curious, or if you want to keep track, or if any of these appeal to you and you want to make a big circle around it so that next time you go through your handout, you'll remember that this appealed to you. Cortisol increases your appetite, and it increases your intake of high-calorie food. And if you think about why, it's because your body's really smart. And if you've been running away from the tiger, you need to refuel. So cortisol will increase your appetite. Chronic stress also raises your blood sugar. Again, if you're running away from the tiger, you need lots of sugar available to your muscles and your brain so you can think about what to do and you can run away. But what happens if you raise your blood sugar over time is you also raise insulin, because insulin needs to bring the blood sugar down. You got lots of insulin receptors right here. Lots of insulin receptors. So if you're making high blood sugar and you're making high insulin, you're going to end up putting on weight around your middle. Chronic stress also depletes the neurotransmitter called serotonin in the brain, which leads to sugar and carbohydrate cravings. Anybody ever feel that way? High cortisol increases belly fat. The abdominal fat cells have more cortisol receptors than other cells do. The 11-beta hydrogenase enzyme is actually made in abdominal fat cells, so you tend to make more cortisol in the belly fat. So it's like a positive feedback cycle. Cortisol also inhibits fat mobilization from cells. So sometimes people will tell Daniel when they're part of the program, I don't know why I'm not losing weight, but their stress is off the charts. Well, this can be part of the reason. High cortisol inhibits thyroid hormone, both production and its release. It also inhibits how thyroid hormone functions at the cellular level. So thyroid's your most important hormone for your metabolism. So if you're under chronic stress, you can see why you may have some symptoms of hypothyroidism, even if you're making plenty of thyroid hormone. And cortisol reduces the 2 most important hormones to build tissue, especially muscle and lean body mass, and that is testosterone and growth hormone. Cortisol will lower both of those, both the output and the function. And again, the body is smart. If you're running away from the tiger, that's top priority, not repairing your tissues, right? Too much stress also stimulates something called neuropeptide Y. And neuropeptide Y actually forms new fat cells. So mice that have been fed the exact same diet, one of the mice gets stressed, the other mice doesn't. The stressed mice on the same diet gets fatter than the unstressed mice. This is a big deal, huh? Okay, this is number 7 if you're following along. Which glands are critical for production of sex hormones, estradiol, progesterone, and testosterone in both men and women as you age? Adrenal glands, good. And high levels of which hormone can cause low testosterone in men? Cortisol, too much cortisol, also too much insulin lowers testosterone in men. Okay, let's cover thyroid hormone. There's a picture of the sun there, and that's because every single cell of the body needs thyroid hormone. That's why when babies are born, and those of you who have children probably remember the heel stick test that was looking for PKU and hypothyroidism. Because if we let babies grow up who are hypothyroid and we don't treat them, they become retarded, literally. So thyroid hormone is an extremely important hormone for every cell of your body. It's the main hormone responsible for your metabolism and energy levels. Also increases the speed of thinking. So that's why if your thyroid's low, you can have trouble thinking or you feel like you're slow thinking. Important for a positive, stable mood, and very important for your energy level, especially in the morning. So low thyroid patients, oftentimes we have a pretty hard time getting out of bed in the morning. We're pretty tired in the morning. Thyroid hormone is critical for normal immune function. It's needed for your digestion and for normal skin, for normal hair, and for healthy nails. It's also required for heart function and normal cholesterol levels. In fact, if you're hypothyroid, you can have high cholesterol from that. For those of you who are geeky and want to know this information, there are 2 main thyroid hormones, T4 and T3. And T4 is the pro-hormone. It gets converted into the active hormone called T3. There are some things that help with this conversion, or it actually can prevent it, like nutrient deficiencies, selenium and zinc. Also mercury, high cortisol, too much stress prevents this enzyme from forming adequate thyroid hormone. Fasting, so not eating, slows your thyroid hormone conversion. And certain medications can slow it also. What this means is your thyroid might be making plenty of hormone, but you're not turning it into active hormone. And these are some causes of a damaged metabolism. I'm passionate about teaching this because when I was in medical school, I gained 64 pounds, which is a lot of weight on my frame. So I started school at 119, and when I ended my residency, I was 184 or 185. Yeah, a lot of weight. And I was actually a triathlete and a marathon runner. But I fasted a lot, because I thought fasting was healthy. So I would go on water fasts, I would go on juice fasts, you name it, I did it because I thought it was healthy. All the while going to school, working, and attempting to survive on what little money I made. So this is what I don't want you to do to your metabolism, because that's what happened to me and why it took me years to start to get back to where I am. Starvation and low-calorie diets absolutely damage the metabolism. 500 calories a day, along with some magic drops that supposedly decrease your appetite, can damage your metabolism. Yo-yo dieting will damage your metabolism. Very low-fat or low-carbohydrate diets, because you need all your body's nutrients. Repeated or prolonged fasting, not healthy, can damage your metabolism. Over-exercising and chronic stress, I think I did most of these things. And it can damage your metabolism for a long time. It can take a long time to repair. So I don't want you to do those things. When you deprive your body by dieting, it may interpret this as starvation and adapt as necessary to survive. Let's talk about insulin, and that's a photomicrograph of the insulin molecule. Insulin is made by your pancreas in response to the amount of sugar in your bloodstream. It's needed for your cells to be able to take in glucose to use glucose. And it stimulates cholesterol production. It's also the main hormone that's responsible for the storage of energy, i.e. fat. Not enough insulin is called type 1 diabetes. Too much insulin is type 2 or non-insulin dependent. These definitions are getting changed because a lot of type 2s can become type 1 because they become insulin dependent by burning out their pancreas. But for the most part, there are 2 main types of diabetes. So what is insulin resistance? Have you heard this term, insulin resistance? Insulin resistance precedes diabetes, but it's at the stage where you can do something about it. If you become diabetic, I've only seen one person in my entire practice actually reverse it. So it's a lot easier to reverse at the insulin resistance stage. And this is what happens. High blood sugar, so you've got a lot of sugar in your bloodstream, leads to your pancreas making a lot of insulin to bring that blood sugar down. After a while, your cells don't respond to the insulin anymore. This is like somebody knocking on your door who you want to go away. You ignore them. So the knocking gets louder because the pancreas makes more and more insulin, trying to bring that blood sugar down. And when the pancreas cannot make enough insulin anymore to bring that pancreas down, you now have type 2 diabetes because your glucose stays high. So does that make sense? This is a process. This is something that we can see happen over time. So if your doctor says your blood sugar is normal, you want to know what the number is. Because 100 is not normal. 100 is indicative of some degree of insulin resistance. 90 is normal. 126 is diabetes. That doesn't happen overnight. It's a progression. And if you're at the stage of insulin resistance, it's critical to reverse it so you don't end up with diabetes. And we'll talk about how. Chronic high insulin is like the Tasmanian devil. It disrupts all other hormones. It accelerates aging and leads to chronic inflammation and degenerative diseases. It causes obesity. 23% of Americans over the age of 60 are diabetic, nearly 1 in 4. And you've probably seen these statistics before on obesity. Currently, a third of our kids are overweight, 17% are clinically obese. 2/3 of adults are overweight. Over a third now, that's actually new data that I just got 2 days ago, of adults are obese, more than a third. And by 2015, 75%, 3 out of 4 Americans will be overweight or obese. This is an epidemic. If this was a viral disease or a bacterial disease, it would be an epidemic. So just to give you kind of a pictorial view of how this has occurred over time, I put together some slides from the CDC so you could get an idea of this. And what you want to look at is the year. So this is when they started keeping the data, which was 1985. And by the way, obesity is defined as a BMI over 30. Overweight is 25 to 30. And you should all know your BMI. It's now considered a statistic that when you go to your doctor, just like the vital signs, we now calculate BMI. The states that are white, there was no data given to the CDC. The states that are light blue, less than 10% of that population is obese, BMI over 30. The states that are a little bit darker blue, 10 to 14% of those states are obese. Okay, this is 1985. This is 1986, 1987, 1988, 1989, 1990. 1991, we have a new category. So in 1991, we need to add 15 to 19% of the population of the darker blue states are now obese, clinically obese. This is 1991. 1992, 1993, 1994, 1995, 1996, 1997. We have a new color we need to add because 20% of these states are now clinically obese, the population. So 1 in 5 in 1997 in these states is clinically obese. 15 to 19% of the dark blue states. 1998, 1999, 2000, 2001. We have another color to add, and that's orange. So the orange states, more than 25%, or 1 in 4 of that population in the year 2001, clinically obese, 20 to 24% in the tan states. This is 2001. 2002, 2003, 2004, 2005. We have another color to add. 2005, just 7 years ago, greater than 30% of the red states are clinically obese. That's almost 1 in 3 Americans in those states are clinically obese. The orange states, 25 to 29% are obese, and the tan states, 20 to 24%. 2006, 2007, 2008, 2009, and 2010, which is the last year that we have data for. So that's where we're at right now with the obesity epidemic with a capital E. 30% of these states' population are clinically obese. 25 to 29% of the orange states clinically obese, and Colorado has now joined the ranks of the tan states. There isn't a single state in our country where less than 15% of the population is clinically obese. So why does it matter? Why does it matter if we're overweight or obese? Because Being overweight increases your risk of cardiovascular disease, that's heart disease, type 2 diabetes, breast cancer, high blood pressure, gallstones, arthritis, sleep apnea, and depression. In fact, the International Agency for Research on Cancer from the World Health Organization attributes 1/4 to 1/3 of all cancers of the breast, colon, uterus, esophagus, and kidney to physical inactivity and being overweight. These are preventable cancers. So this is what people who live to be 100 know. There are databases of centenarians now, so people who've made it to their 100th birthday. And these are some of the things we know from looking at all the data. The average lifespan right now is 78 years old. Anybody in here want to live to be 100? Besides me. Excellent. Anybody in here want to live to be 85 or maybe is 85? Some people aren't raising their hands. Some people don't want to live to be 85, really? So I want you to keep your hands up. Keep your hands up if you want to live to be 85. Now I want you to look around the room. 1 in 2, 50%, maybe it's the person sitting next to you, maybe it's you yourself, will have dementia or Alzheimer's by the age of 85. 50% if you don't do something about it. So if you're 50 now, your chance of making it to 100 is about 1 in 6. And here are the factors that will help you that we know from the data. Don't overeat, right? Calorie restriction. Don't develop insulin resistance or diabetes. Not going to make it if you have insulin resistance or diabetes. Maintain a high HDL. That's very cardioprotective. So that means eat well and exercise. Maintain high antioxidant intake to prevent internal rusting. And stay socially connected. People who isolate don't tend to live as long. It's the oldest woman who ever lived, Jeanne Calment. She lived to 122 years old. Isn't she lovely? Yeah, she's French. And every year the French media would gather around her bedside when it was her birthday and ask her for advice. How do you live to be 122 years old? And these are some of the things she would say. She eats garlic and vegetables. She drinks red wine and port. She makes a big deal about avoiding brawls. She uses lots of olive oil on her skin and her food. She ate 2 pounds a week of chocolate. That's what she told the French media. She rode her bike until she was 100. In fact, she took up fencing after that. And her attitude towards stress was, quote, if you can't do anything about it, don't worry about it. So here's our second HormoneSynergy Jeopardy. Your opportunity to win fabulous prizes. You all have a little note card. If you need another note card, raise your hand. And here's the question. And you only need to name 2. Name 2 of the 6 ways we went over on how stress leads to weight gain. So you only need to name 2. For example, you might say, when you're under chronic stress, it decreases serotonin, which causes carbohydrate and sugar cravings, which makes you gain weight. You might say that. You might say that chronic stress increases insulin by increasing blood sugar, causes weight gain. You might say prevents weight loss or fat mobilization. Any of those things. You only need to name 2, and you can look at your handout. And we have 3. Oh, we have 3 prizes now. This is good. 3 fabulous prizes.
HormoneSynergy Daily Essentials and our Men's Essentials. So if a woman wins this one, she'll have to give it to her husband. Actually, we have a women's too. I can do that.
So Katie, do you have the? Oh, you have a box. So does anybody know what page of the PowerPoint those answers are found on? You shout it out. Oh, they were supposed to be paginated. Oh, bad printer. Okay. Okay, I think it's page 10. No, they'll be left. So page 10, if you flip to page, I think flip through 10 pages, it's on the back. Keeps your dopamine up, keeps you focused.
Cool.
Winning prizes, yeah.
Christine's getting some too.
Good. No, too much cortisol lowers testosterone, it lowers growth hormone. Bad stuff, too much of it. Makes you gain weight. Only one lion.
Beautiful.
They're going to do 2 lions.
We could pull it out.
Yeah, we should. Otherwise, it's going to take forever. Okay, anybody need another minute, or you need another minute? You're done? Okay, so these prizes were donated by Douglas Laboratories. Douglas is one of the nutraceutical companies that formulates our nutraceuticals because we tell them what we want and they make it happen. So thank you, Douglas. And we have 3 prizes. So I'll pick 3. That's only 2. Oh, I said 2. Oh, good. Steve Thiem. You are a winner. Excellent, Steve. So you get the men's essentials. So this is an AM PM. So you have to take AM with AM and PM with PM. That's how I designed it. You got to say that because sometimes people don't read them. Judith Arnell, you are such a winner. Judith Arnell has also won, and Judith actually donated these beautiful pearls that I'm wearing today because she is amazing and generous and has a gorgeous jewelry store. Okay, and Dorothy Gutfleischt. I butchered your name, Dorothy. Who's Dorothy? Gutfleisch. Thank you. Gutfleisch. I should have been able to say that. Sorry, Dorothy. Excellent. So these were the 8 ways: increasing appetite, raising blood sugar and insulin, depleting serotonin, which leads to carb cravings, increasing belly fat, inhibiting fat loss from cells, inhibiting thyroid production and release, reducing testosterone and growth hormone, or stimulating neuropeptide Y, which causes formation of new fat cells. Bad.